Hey, everyone's Dr. Morales again. Come back at you from my office. Answering questions related to plastic surgery on a weekly basis. And as again, thank you again for sending your questions. Appreciate it. This is related to my makeover. And the question is, what questions should I ask my plastic surgeon when considering a Maui makeover? Awesome question. Huge topic, right? So I would say most patients who are considering Maui makeover have done quite a bit of research already. That's just the nature of society now. All this information is out there right now, including me, my videos, and everything like that. A lot of surgeons will, kind of give a lot of information on their website, as mine as well. These are procedures that most women have done heavily amount of research on each procedure that they want, what concerns they have and what needs to be addressed, breast or abdomen and body and whatever, okay? When you actually make the decision, I'm gonna go see the surgeon and talk to them what I need and everything like that, you should definitely call their staff ahead of time. Try to get most of your questions addressed through their staff. I'll tell you, in my practice, my staff is extremely informative. They've been working with me for 5 and 8 years now, Rachel and Linda, and they've heard me say the same thing repeatedly for years and years and years. A couple of them have gone through a couple of procedures already with me personally. They have a very intimate knowledge of the procedures. They've seen me do surgery already. They see me do these procedures. I always tell my patients, after they meet me, please use Linda, please use Rachel as a resource of correct information related to the surgery that you are interested in doing, rather than Dr. Google, right? Or getting on the forums and asking all these random questions to random doctors or random people who think they know stuff about plastic surgery. Nonsense. They haven't seen you. They don't know anything about you. That's the honest truth of it. Please use. If you don't choose me, okay. Hope you learned something. Hope you had a educational experience. And if you want to ask Linda something, email her, call her. I actually do want you to have a good result. They're great resources. Please use them, okay? So definitely ahead of time, talk to the staff, talk to the coordinator. You'll probably be a coordinator in contact with them, related to a surgeon. Ask all your questions, write them down, think about it, ask more questions, think of more questions. You want to talk to her again? Give her a call. She loves talking to people. She loves her job. She really enjoys doing what she does. Talk to your husband, talk to your friends, whatever, Obviously go on, you can go to, these groups on Facebook I keep hearing about. Go talk to others, patients who've had surgery with other surgeons. Read reviews of your surgeon. Go look at their galleries of their patients that they worked on their website. If go check out their social media profile and see what they like to do, or what, how they, whatever. If you like a surgeon that's dancing and acting like a clown all the time, that's not me. I'll tell you that, it's not me. But it is some people. They want to be like these Instagram celebrities, and they want to be, I want to have this doctor work on me because he's on social media and he's a TikTok star. I just don't care. I love what I do. I love my patients. I love working with my patients. And that's kind of nuts and bolts of that. I'll tell you that. I'll be very honest with you. The discussions you should have with plastic surgery when you actually come in are typically just kind of reinforcing some of the questions you already have answered, with Linda. For me, specifically with Linda or Rachel. She'd ask, how long you've been doing this? Are you bored? Are you American board of plastic surgery? Boarded. Okay? This cosmetic board, not real. It's not a recognized board in the country. It is not. Who gets that board certification? Or dermatologists, general surgeons, OB-GYNs. That is not their specialty. They say they're boarded, they're not. They did this training, supposedly some indoors kind of training facility. Not the same. We're not the same, okay? That's the fact. So you want to have, cosmetic surgery, please go see an American board certified plastic surgeon. It's all about safety and outcomes. And if you've done everything to get that, to qualify to sit for the boards and actually go through the pain and suffering and the strict requirements to get it done, then that gives you the certification for the board certification. And for us, that's like our Mount Everest. So we have to get that board certification, get that certification, and there you go, then you're board certified. and that's an endorsement of the board certification. Super important, okay? You get that board certification once you've graduated your residency in plastic surgery, and then you got to sit for your boards. You got to take this exam. It takes about 2 years. So it's a labor of love. It's a labor of dedication and commitment. So take a lot of pride in that. That's your first question. Second question is, what type of anesthesia do you use? I would ask. And local anesthesia. Some do these sedation stuff. General anesthesia. You want to know where they're doing their surgery. Is it going to be in the hospital? Is it going to be in a surgery center? Is it going to be in an outpatient surgery center? What kind of surgery center is it? Is it a surgery center where you're going to be having, other specialties are involved, like orthopedics or colonoscopies, those kind of other surgeons, or it's going to be a private outpatient surgery? All they do is cosmetic surgery. That's mine. Is it going to be in a quad ASF operating room in the back of an office? Questions you should ask. So, these are, you definitely want to ask that. What is your complication rate? What is your revision rate? Have you had anyone die? Not me. Those are valid questions. You should definitely ask. This is surgery. This is not something you should take lightly. This is real surgery. Mommy makeovers are big surgeries too, right? So take those in consideration. I'm not trying to scare anybody. I just want you to be prepared for it. And I would say most people who are considering my makeover are going to be well prepared, I hope. Those are kind of the big questions you want to ask. Obviously do your reviews of the surgeon who's doing the procedure. Look at their photo galleries on their website. They have a website. And if there's forums on Facebook or I don't know, whatever, just do your research. Take your time. These surgeries are planned months in advance. I'll tell you that. My makers on booked out for like 6 months. So it's something women are planning months and months ahead of time for purposes of their personal life or work life, right? Kids are out of school, vacations of the summer, holiday stuff. I don't know. But do your research early. Try to schedule your surgery well in advance of when you actually want it, okay? You want to make sure you get that time. If that surgery's booked out for a long time, you want to do it now. You want to start talking about it now, okay? So, great question. Again, board certified plastic surgeon. Use one, okay? And if you're interested, you know how to get a hold of me. Thanks for your time. See y'all next week. Bye.